Hello, ladies and gentlemen. Welcome to HAS 20 Virtual Summit Breakouts. During this session, you'll be able to submit questions and upvote questions from other attendees. The questions with the most votes will most likely be among the questions asked by the host to the presenter at the end of the session during the live Q&A. The bottom right tile box is where you can type in your question as well as click the thumbs up button to upvote a question. During the session on the top right tile box, you will also see a 5-question quiz based on the speaker's content. Enhance your learning by taking the quiz during the session and get points for your correct answers. All sessions will be available on demand, and if the presenter has given us permission, you will also be able to download the slides. It is now my pleasure to introduce Session 7, Improving Revenue Cycle Performance with a Patient-Centered Care Access Center. It will be presented by Jennifer Livermore, Director, Access Operations, ProHealth Care. Enjoy the session.
Thank you for joining me today. My name is Jennifer Livermore, and I'm the Director of Access Operations for ProHealth Care. And I'm here to share with you today our project on improving revenue cycle performance with the Patient-Centered Access Center. The agenda for today's presentation is we'll be reviewing the learning objectives, talking about our journey understanding the relationship between revenue cycle and access, and we're going to talk about 3 different themes to improve revenue cycle through access, including access advancement, resource optimization, and stakeholder engagement. Revenue cycle improvements and results, and how you can implement change in other hospital departments. The learning objectives for today will be to define the impact of COVID-19 on revenue cycle and operations, understand how access is the foundation for revenue performance, discussing how we improve access through increased responsiveness, resource optimization, and stakeholder engagement, and reviewing lessons learned and key takeaways to apply at other health systems. The first thing we did is we defined access as part of our vision. We broke it into 3 components: clinical excellence, innovation, and access. This was a key starting point for our organization. The project overview is as follows. We really took a deep dive into historical access pathways. We learned that there was very inconsistent access in clinic and hospital operations. The patient was directed in many different pathways, and it was very confusing. We knew we had to define what care access would be. For our organization, it means pre-service healthcare activities that result in a seamless transition from identification of all the healthcare needs that the patient has to the point of arrival for care. We made a commitment to focus on the patient experience, optimize efficiency, and partner and collaborate with key stakeholders across our organization. We started with an opportunity assessment and an engagement timeline for this work. The assessment yielded opportunity in 3 different areas: access advancement, resource optimization, and stakeholder engagement. We took a look at all of these in total and designed a consistent experience to work ourselves through this phases of this project. We looked at consistent scheduling, responsiveness to requests, matching patients to optimal services, and making sure that we were transparent with publishing metrics about this work. We optimized resources by centralizing and cross-training staff, reflecting accurate resource availability, and looked at our compactable cancellation and patient no-show rates. We also enlisted weight management support and backfill for cancellations, and most importantly, we gained stakeholder engagement through collaborative governance structures and leverage our positive improvements to gauge the ProHealth Care brand. We did this in 2 phases. The first, solution enhancement, access model design, and reporting solutions. Then we looked at expansion, accountability, and ongoing implementation and sustainability planning. For our executive summary, a solid foundation for access had been established. Now ProHealth Care can identify areas for improvement. In access advancement, we installed Care Access Reporting Suite to over 95 users and removed assumptions regarding access performance around the organization. We were able to establish 5 accountability forums across hospital and medical group operations to diagnose access issues proactively. We were able to optimize and improve referral conversion by over 5% and increase bookable hours by over 22% annually in the organization. As far as stakeholder engagement, we answered 300 more patient calls each week by reducing abandonment rates alone, and yielded over 800 more monthly patient visits by reducing cancellation rates. Our next steps were to expand to additional service areas not within the scopes of the early phases of the project and leverage our lessons learned from the creation of the Centralized Access Center to improve and create a clinical contact center. We looked at the phases that you can see here. We divided up each area of the organization into a phased approach. Some of them took more than 1 phase and continued to work towards phasing in the remainder of the the departments within the organization. So our project achievements. With opportunity assessment in the access advancement category, we looked at the consistent scheduling experience, responsiveness to patient requests, matching patients to the optimal service provider and location within our organization, and being transparent with our performance metrics and accountability to those measures of success. What that looked like before was decentralized, undefined ownership of referrals and orders work, a really inconsistent call center responsiveness and messages, leading to patient and care setting dissatisfaction. We had an inefficient use of staff during low call volume time. So what that looks like now for us is we have centralized ownership with accountability. We created a service level agreement for the Access Center for the departments that we serve. We trained our teams to provide a consistent access experience across all locations in our organization and implemented staff management dashboards to support appropriate assignment of work. The measures are call center service levels defined as answering a call within 30 seconds or less. Our baseline number was 53%. We've been able to improve that to 87% of the time. Our abandonment rates reduced by half with a baseline of 6% down to 3%, and some months even being less than that. Our referral conversion rate improved, and our referral turnaround time improved. As far as performance metrics go, before it was very difficult to monitor access trends due to missing data, multiple sources across the organization. There was a lack of transparency for performance and inconsistent review of key performance indicators for access. Now we have a consistent way to approach data across the organization and dashboards that allow us to monitor performance and formulate action plans to drive improvement. Our Care Access Reporting Tool dashboard gives us complete access to metric transparency across the organization, and the stakeholders are accountable for their performance in reviewing this information. Measures, over 476 departments for visits, referrals, and utilization data is available to us on a weekly basis. We have over 400 providers, their individual utilization metrics available to us weekly, as well as referral information and helping us manage our contact service queues to make sure that we have appropriate service levels and abandonment rates, and we can monitor that in real time. Our resource optimization assessment really looked at how we centralized and cross-trained our staff, reflect accurate availability of resources, utilize tools to minimize cancellations and no-shows, and enlisted waitlist management tools support backfilling openings in provider schedules. This occurred through template management. So before this process, our schedule management practices varied widely from department to department and down to the provider level. There was a lack of clarity around template maintenance and ownership, and really a lack of familiarity with IT support processes. Now we have template analysis that allows us to have a protocol, guideline, and a clear understanding of what our standard template policies are across the organization. We train template owners of those applications to the organizational standard and defined approval process for changes to the standard. The measures allowed us to increase scheduled utilization, comprehensive utilization across the organization, and allowed our providers to have an increase in visits per session. For cancellation, no-show, waitlist, and recall management, again, lack of clarity before. There was multiple cancellation reasons not used consistently. Even how we defined a no-show to an appointment was defined differently from department to department. We had a wide range of how we managed waitlists and recall lists depending on the different practice or location. And appointment reminders were manual and very inconsistent. Now we have a proactive process for all 4 workflows adopted. We've streamlined our cancellation reasons. We trained our team members on what they are and how to use them. We've clarified the no-show policy, what it means, and also automated all of our appointment reminder technology. This helped us improve baseline cancellation rates from 25% down to 16%. Appointment reminders also, we were able to increase confirmation responses from 30% to over 50%, with almost 74% of our patients actively confirming their appointments across the system, and 88.7% of our patients opted into using texting as that method of confirmation. For stakeholder engagement, we created collaborative governance structures to make sure that we designed and set goals and performance evaluations and how to resolve issues across the system. We partnered with our clinical and administrative leaders and leveraged these improvements to market the ProHealth Care brand. So before, our schedule management practices were varied by department. Again, lack of clarity around template maintenance and ownership, and lack of familiarity with IT processes. Now, We have a role that's accountable for access performance. We have forums to discuss our successes and challenges. And we also have clear expectations for the care setting, as well as the access center per the service level agreement. We collaborate and problem solve together, and it's been amazing. Our measures, forms, and frequencies, we meet with the operations team weekly. Our access operations leaders meet monthly. And our access issues review is a forum in where it's a multidisciplinary team that get together to look at overarching system issues relating to access and come up with solutions. And then we also have operational work groups that meet monthly with the individual departments across the organization. So referral leakage. Before, we really did not have a good way to accurately capture the data around referrals that were going outside of our system. In the absence of existing forums, we really couldn't discuss outbound referral patterns. We didn't even know where we stood with that. Providers often were misclassifying referrals that were truly internal to our organization as external, which muddied up the results a little bit. But now, we have a care access dashboard that compiles all the referral pattern data for us. We can trend the information and really take a look at all of our referral patterns across the organization. We created how-to materials and communication for our providers and improved the process so it was easy for our providers to enter a referral accurately within the system. Our measures, almost 17% of the referrals were outgoing when we started this journey several years ago. And most recently, that was reduced to 7.8%. So with that, obviously increased financial opportunity for our system. So a consolidated access center. In review, how do you leverage an access center and the associated benefits? By looking at the approach we took non-clinical tasks out of our clinical care teams and let them leverage and work to the highest degree of licensure. We provided common interfaces for commonly asked patient questions, so there was consistent answers across the organization. And we were able to manage care outside of a hospital-based setting and really focus on how do we manage population risk across our community. We established similar processes across many of the care settings. We were able to reduce the number of interactions required for patients to fulfill requests for things like prescription refills, clinical questions, telemedicine, health coach interaction. And we also really leveraged technology to improve the process of routing and answering practice questions. And we're able to provide some non-urgent care or non-emergency department care options for patients to seek advice or render care across the system. Our goal was to provide a one-stop shop for consumers that were healthcare shopping. We were able to direct consumers to the right place. We made it simple. One place that they could call to find out what their options were. We were also able to capture information about consumers via our customer relation management software. The benefits to this are really to improve first call requests, resolution by greater than 10%, which we were able to accomplish. We want to reduce readmissions for the organization, both for inpatient but urgent care and emergency department as well. We wanted to increase touch points with clinically complex patients, enhance and improve volumes and type of requests, and build a better patient experience. So current state for us. This is where our Care Access Center is located in Wisconsin. This was previously a clinic location that we revamped, redesigned to make it appropriate for care access operations. The new structure, which enhances the ease of access for patients, it looks very different than what it did before. We now are the primary point of contact for ProHealth Care and align with many of the tasks that you see here today. So not just scheduling and appointment reminders, but waitlist management, referral outreach, population health outreach, pre-registration authorization, physician referrals. We house the internal answering service for the organization. We're able to schedule, navigate across the continuum through the whole organization, support our service lines. We have nurses doing telephone nursing triage, assist with virtual health services, as well as with transitional care management and population health management throughout the organization by engaging patients in their care and keeping them on track. And just to note that the infrastructure for care access lives within the revenue cycle of our organization. So when you look at basis access process elements, this is something that we talk to all of our teams about, that no matter where you live within an organization, the process is really the same. A patient enters the system either by their own referral, via triage, or a provider refers. An authorization or pre-certification process begins. Comprehensive scheduling services occurs after that, whether it be primary, specialty, or virtual care services. The services are completed, next steps are identified. The patient either does that at the time of service, and if not, we take that on and manage the recall and outreach to that patient to start the process all over again. So our Care Access Center activities at a glance. We are a resource to support the access strategy for all of ProHealth Care. We assist with patient portal sign-up and proxy access for minors. We assist in managing the digital communication for the organization. We support an open access scheduling model via multi-access channels. So that could be calling, information coming in through our consumer website or through our patient portal. We follow up with consumer requests for services. We monitor the care access reporting technology. We are also very instrumental in the patient access kiosk implementation and support. So in our ambulatory centers, we have registration kiosks available, and we promote and support those through the Care Access Center, as well as electronic check-in, which is extremely important in this time. We support patient engagement strategy and our care management strategy for the organization. Something that I wanted to call out on how we've designed our teams within the Care Access Center is we adopted what we call a pod model, which is a little bit different than what we've seen in other areas. So I wanted to talk a little bit about that. Typically, you would have teams that schedule for like services together. So for example, a dermatology scheduling team, a primary care scheduling team that had some adjacencies or work together, which we learned was important, but we learned where the gap was is all of these services are so connected in our organization that they needed someone close by to tap. So we adopted a pod model, which includes primary care schedulers, specialty care schedulers, pre-registration team members, prior authorization, and nurses to be able to facilitate a seamless experience for the patient, as well as communicating with each other in their daily work. This is just a quick look at what our access performance measurement dashboard is. There's much more to it than this, but I wanted to give you an idea. It's great to have data, and we can get data in many sources, but when you have a tool that puts data together to use in a meaningful way, it becomes very instrumental in how you measure and plan for access in your organization. To give you an idea of the current departments that we serve in our Access Center, I won't go through all of them, but all of our clinic-based specialties, all of our primary care specialties, we schedule for our senior living clinics, we house the physician referral service, we do all of the community class registrations for our area. We support our family medicine residency program, chronic care, imaging, heart and vascular, general vascular, respiratory, and surgical, both pre-procedure, and we book the OR suites for our patients. So our future departmental access integrations include finishing up part of our phase 3 work, which did change a little bit along the way, but everyone's included nonetheless. We're working actively with our neuroscience service line, including interventional pain, our sleep center, women's health service line, oncology, our outpatient therapies, and occupational health teams. We also support our digital communication technology, which includes how we communicate with patients, understanding that patients have options on how they would like to be communicated with versus how we would like to communicate with them. So we implemented options of text, email, and phone for appointment reminders. We also have real-time patient experience surveys for both scheduling and appointment experiences. We have automated waitlist backfill, which is technology that allows us to have real-time closure of gaps in schedules when a patient cancels. Traditionally, you'd have to go to a waitlist, start making phone calls on patients for that waitlist. This all happens behind the scenes, and the appointment is placed directly into the electronic medical record. We facilitate outreach for recalls, referrals, population health care gaps, and also patients that have self-pay balances. So the future of care access. We continue to support online scheduling. That is something that our organization does today, but also something that we know that we need to grow. Our electronic check-in features. We are encouraging people to use electronic check-in where possible to minimize their time in clinic. We are looking to expand our patient navigation model. Typically, when we think of navigation, it's around clinical services. We're looking at the approach from a schedule navigation model within our Access Center. How do we continue to connect our patients with all of the services across the organization with one touch, one call resolution? We'll be upgrading our CRM module to something a little more up to date. We've had it for a while, and we know we need to look at other opportunities there. We're looking at pre-service patient estimates and point of service collections. expanded patient communications, particularly around post-service follow-up communication. How do we really keep in touch with those patients that are discharging from ED, urgent care, or inpatient? We do a pretty good job now, but we want to look at other ways that we can do that more effectively and more efficiently. We'll also be expanding our population health outreach. We are a next-gen ACO, and it's very important to us to make sure that all of our patients are getting the care that they need in a timely fashion. So we're looking at ways to optimize that, and also be expanding our nurse triage within the Access Center to 24/7 service. Additional improvements that we're looking at, I talked a little bit before about the appointment autofill. The logic that we had initially created for that was very tight, if you will. We weren't sure how it would work, but it is working beautifully, and so much that the providers have agreed to loosen the restrictions. Instead of having a one-to-one match on a cancellation versus a backfill appointment, they've agreed to just look at time, and if there's a spot, let's fill it. So we're moving towards that. We also added surgery scheduling to the Access Center within the last few months. So not only are we able to schedule any preoperative work, any pre-procedure testing or screening that needs to be done, we can actually book their procedure in the OR all at one time. And as I had mentioned before, we'll be implementing our oncology, neuroscience, and women's health service lines coming in the next couple of months. We will remain a central point of contact for ProHealth Care patients. So really looking at how is Access the foundation for optimum revenue cycle performance? When we look at advancement, optimization, and stakeholder engagement, we really want to look at the things that brought us along this journey. So at the end of the day, we were able to improve revenue and satisfaction by standardization of processes, improved patient experience, and measurement reporting and accountability to drive results. We also were able to optimize capacity and improved access. We were able to scale this model for growth, which we continue to do, and really optimize and use our existing resources efficiently. And as far as revenue growth, ownership, collaboration, and buy-in was key. We were able to reduce referral leakage and increase revenue that way and continue to grow and expand. So impact of COVID-19. How did this help us to make quick responses for the COVID-19 pandemic? Patient flow. We were able to make system changes in quick time to assist with patient flow management during the pandemic. We were able to make rapid messaging changes to our patients via digital communication and through our Access associates, aligning with whatever the system objective was during that period of time and continues to be. We were able to consistently screen patients calling in for COVID-19 symptoms and have clear pathways on how we were to manage them throughout the system. We were able to do robust patient follow-up for post-discharge patients that had COVID-19, either coming from inpatient and ED, and we offered this resource to our teams 24/7. We were able to convert thousands of in-person visits to video and telephonic visits in collaboration with our care teams. We were able to measure and monitor scheduled and completed utilization, so understanding what the pandemic did from a revenue perspective, but also how quickly we were able to re-engage once some of our regulatory requirements were met in our state. Self-service, we were able to engage in promoting electronic check-in and kiosk usage in our ambulatory centers where possible. We continue to work with our patients, engage with them, and teach them how they can have contactless points within our clinics coming in. As we know, there's still fear out there of patients coming in and being near people. Our patient portal, we were able to support online and patient scheduling of services. We contracted with our local EMS as their 911 backup partner. So we went through significant training with our nurses on site and worked out a process with our local EMS to be backup for telephone triage for patients coming in should they exceed capacity to do so. We were able to set up a COVID-19 hotline for questions and answers and patient navigation. That was a 24 hours a day staff service. It still is. And that actually was set up in 24 hours and training occurred all in that time. We continue to track and assist with all patients that had either self-delayed their care, canceled, or patients that we need to move or cancel for the best care for that patient. So we consistently are able to track and do outreach and make sure nobody slips through the cracks and everybody gets back on track with their care. And also influenced our electronic health record template management to accommodate requests and understand the new patterns and alignment of system goals since the pandemic. Our results: a consistent patient experience, optimal matching to system and services, and performance accountability for all access functions in the organization. We were able to optimize resource utilization and capacity, centralize and cross-train team members, provide accuracy with scheduling to align with system expectations, create a collaborative governance and access functions, stakeholder engagement, and revenue growth. So our key learnings and recommendations. First step, stakeholder engagement and collaborative governance is essential in this process. Change is hard enough as it is. We want to make sure that we're engaging all the right people before we go to this model. Consolidation of front-end revenue cycle function is foundation for success. It is the beginning of the revenue cycle, and it needs to be streamlined throughout the whole process. Standardization of access functions also contributed to improved utilization and capacity in nearly every area of our organization that we standardized. And also engaging in digital solutions and real-time data management allows for success in access operations. It becomes nearly impossible to manage this with people alone. So digital technology is your friend. And we'll take time for questions and answers.